Hi, I'm Yvonne Guibert with Work Comp Central, and today we're talking to Joseph Molloy from Northwell Health. Hi, Joseph.
Hello, Yvonne. How are you?
I am good. So I know we were chatting, you're in New York, and today's sort of a gloomy day. I'm in Tampa. Thanks for joining us.
Glad to be here.
I know we're looking forward to spring, right?
Well, I'm a snow person, so
How are you?
yeah.
Wonderful.
Fall, winter, those are my seasons.
Nice. Well, because I live in Florida, I like the warm weather. I like to visit the snow every once in a while, but I don't know how you guys shovel your way in and out when it gets to be that time of the year.
Got to do what you got to do.
That's right. So we're talking today. Congratulations. You were the winner for the employer category of the Comp Laude Awards and Gala for the 2020 year. So congratulations.
Thank you. Thank you so much. It's an honor.
Well, I know as we've chatted before, I chatted with you earlier before the awards were announced. I did your vetting call and got to ask you a lot of questions and found out a lot about what you guys do there at Northwell Health. And I was very impressed. And I know that I've seen you guys in the news a lot over the last few months. Correct me if I'm wrong. Did the first COVID vaccination happen in one of your facilities?
It did. New York was clearly the epicenter of the COVID crisis, and we've treated more than 100,000 COVID patients. In fact, even as of today, we're running between 700 and 800 COVID inpatients every day. The crisis is far from over, although the tidal wave, I think, seems to be ebbing some. But yeah, we were right in the midst of it. Governor Cuomo was doing daily briefings, and our president and CEO, Michael Dowling, was in on many of those. And we were providing a lot of clinical advice and guidance to the state of New York and subsequently to many around across the country.
Well, thank you for everything that you do and that Northwell Health does to keep New Yorkers safe and also your employees safe. So let's talk about what you guys do for your program with your employees. That's what I chatted with you about, as I said, in the vetting process. And let me also mention, I know from personal experience that you all have been a finalist for several years running. So let me ask you, first of all, since you've been through the process a few times, what does it mean to you, to be nominated? And then, when you found out that you won, tell me what that was like. How did you feel?
So honestly, it was almost a relief because we had been in the finalist category quite a few years. It's a great recognition of not only the programs that we've built and the successes that we've had, but the persistency with we function. Being able to be a finalist year after year just means that our programs are continuing to do what we intended them to do. So winning finally was like, yay! I'm not entirely sure what put us over the top. But it was a great recognition of the team and the programs and the support that we get from senior leadership.
Certainly. Well, I definitely know that, as you mentioned, being a finalist for several years running certainly played a role. That demonstrates that you're in it for the long haul, so to speak, doing the right thing. And I don't want to say, unfortunately, I know we're all coming to grips with living the pandemic way and doing things differently, but I personally was a little sad to not be able to get to meet you in person because we did this virtually, and normally we have a nice gathering where most of the folks are able to come in person. So I did miss that element. Hopefully we'll get to meet in person one day.
One day, I'm hoping not too distant future.
Right. So what is your plan going forward now that you've achieved the win and have the win as a Comp Laude award winner? What is your plan to continue to be a positive influence in the industry? What are your plans going forward?
So one of the things that awards like this give us recognition is we've had a lot of people across the country call us to do presentations, to do webinars. My Safe Patient Handling team has done a few conferences where they've been keynote speakers. And in fact, I just attended a virtual safety conference where one of the participants has asked us to participate in their podcast. So we will continue to build on the successes that we've had, but also develop more. We're really laser focused on workplace violence and doing everything that we can do in that arena, while at the same time being proud to step out and show people best practices and maybe spread the word, as it were, on our missions advocacy. And in the workers' comp environment, it's all too often adversarial, but the advocacy model really can work. It's a big lift. You have to convince a lot of people that it's a different approach, but it works. And our program and the awards that we've received are proof of concept.
Very true. So you mentioned the advocacy model, which is something that is core to the Comp Laude mission and vision. How did you come to understand the advocacy model, and how did you, because I know you personally have a lot of years invested in building this program that you have for the employees of Northwell Health. What was your inspiration for doing that and achieving that?
So back in my background is as a benefits and risk professional. I've spent my career doing that. And back in 2014, senior leadership tapped me to help them figure out what was wrong with workers' comp and our safety programs. I did a considerable amount of research, both externally to what was really working, what was current state of the art, but also internally asking people what was wrong, what was right, were we doing anything right, things of that nature. So having the audience with senior leadership gave me the ability to say, we've been doing it this way for so long and it doesn't work. And, that's that definition of insanity, right? Doing the same thing again and again and expecting a different result. So I made the proposal that said, we're so driven on engaging our employees and taking care of our employees. Why wouldn't we do the same approach with workers' compensation and build this mission of advocacy that says the vast majority of employees are legitimately injured, legitimately want to treat, legitimately want to get back to work. And the pushback that you get is for the people who are playing the system. The person who has nonstop injuries, the person who's out on workers' comp more than they're in, those kinds of things. And I said, you don't build a program for what I've colloquially referred to as the tail wagging the dog.
Correct.
You use other tools to address those people, but when you have, let's call it 95% of your people, that's what you build your programs for. That's what you do it. And even things like transitional return to work. There are people in the past who'd be like, no, unless the person's 100%, I don't want them back. We had to overcome that hurdle. And that was actually an interesting approach, because the way that we did that was the person who was injured, who was coming back on a transitional assignment, if you didn't take them into the department, then we placed them somewhere else, but we still charge the home department the cost of that. And when you do that 2 or 3 times to a department manager and they recognize, hey, wait a minute, I'm getting charged for this person anyway, and they're working in a different department, all of a sudden they become a little bit more acceptable and agreeable to transitional assignments. Quite frankly, we've made sure that we did not use the phraseology light duty. We didn't want to do that. We wanted to call it a transitional assignment. It's a limited amount of time. There's an expectation that at the end of the assignment, you'll be back full time. And that's what we told these managers, is that the statistics are very clear that if you bring people back like that, their lengths of absence are shorter. They come back sooner. They stay engaged. And that was an important part of that particular program, was let's keep the employee engaged. Let's do what we can to get them back. And we have some unique assignments, and it's funny because some of our managers, we ask, you got to be a little creative with things.
Mm-hmm.
So, an anecdote I love to tell is we had a nurse who had fallen down and had broken both wrists.
Oh, wow.
So she couldn't obviously do, as a floor nurse, her job. And, we were trying to find something for her. And he said, well, let's put neon paint on her casts and put her in the parking lot to direct traffic. And I'm like, I love the out of the box thinking, but that's not exactly what we're talking about. So everyone had a good chuckle over that. But you have to be creative. You have to convince people that this is a better way to go, and use data.
Yeah.
The data proves it. It's proven it, and it's been successful.
Well, thank you for sharing. And what else? What message or takeaway do you have, let me ask you this. So if you were to be talking to a person who maybe has said, I brought this type of program to senior leadership and I just can't get their buy-in, what advice do you have? I heard you talk a lot about the data and, the percentages of people that legitimately want to get back to work and so on and so forth. And that's pretty common across the board. But what advice would you have for a person that maybe has tried in the past and just hasn't been able to get senior leadership buy-in? What then?
Well, two things. One, you would pointed out the data, and the data is key. And if you haven't been able to put in a program, you need to leverage what the costs of an employee being out on workers' comp are against having them come back sooner, putting in programs that minimize severity or decrease frequency, and how that will relate to the bottom line numbers, and use outside sources of data. Remember, back in 2014, we didn't have a whole lot of really good data. And we certainly didn't have any on return to work programs and things like that because they didn't exist.
Mm-hmm.
So reach out to the sources that are out there, and pick up industry-specific data or geography-specific data, and put that information together, and show the actual costs of injuries. That was one of the things that the prior way we did it was there was a monthly report that was sent out, and in doing my research, it turned out that most of the people either didn't read it or didn't understand it. So it meant nothing. So we were sending out a report that was pretty much useless. So we put in place, with the leadership of each of the hospitals, in the beginning, it was quarterly meetings to go over, these are your 5 highest claims. This is what caused them. This is the job title. Often it was nurses that was getting injured most frequently. And just showing the leadership of each of our hospitals, the top 5 claims cost you $1.2 million. Mm-hmm. And they'd be like, what do you mean? How does that cost me one? And we showed them that even though it's sort of buried in operational expense, it still comes back. We apply the experience to each hospital separately.
Sure.
And that's the one thing. And then the second thing, and I like to use this analogy, I've used it before. I don't know if the audience are big Star Wars fans, but the first Star Wars, which was actually the fourth Star Wars, there's a scene where Luke Skywalker is flying the X-wing fighter to blow up the Death Star, and in the back of his mind, he hears Obi-Wan Kenobi saying, "Stay on target, stay on target, stay on target." And that's what you have to do. It's just persistency. You have to keep showing the numbers, showing the data, offering to do a pilot. Let me do a pilot in one department or one division, and pick the division that has the worst experience.
Sure.
Because that's low-hanging fruit when you can do things like that. and get people involved and communicate. Line level managers need to know what you're doing and why. Employees need to know what you're doing and why. Leadership needs to know what you're doing and why and what they hope to get out of it. And the last piece of advice would be to focus on the outcomes. The finance numbers will follow, but focus on the outcomes. That, look, we were able to get John Doe back 3 weeks early. In the healthcare environment, that's particularly critical because the vast majority of our injuries require us to get backfill and replacement employees. Mm-hmm. So I have overtime costs, agency costs, per diem costs, things like that when somebody's out on workers' comp, and I'm still giving benefit to the person who's out on workers' comp. So there's a double hit in the healthcare environment. So if I can bring back somebody 2 weeks early, that's 2 weeks early that the employee's back, plus that's 2 weeks less I have to spend on backfill costs.
Wow. Well, thank you that sounds like a lot of great advice. I feel like I could talk to you for another 20 or 30 minutes and pick your brain. So hopefully we'll have a chance to do that in the future.
We will.
Any final words on, again, congratulations for winning the award. We're so happy that you've been a finalist for several years in a row, but even more happy that you won. So anybody else that you'd like to say thank you to, or any other remarks before we close?
I absolutely have to thank everybody on the workforce safety team. I might have been the architect of all of this, but without their hard work, dedication, and their ideas, their input, this would not have happened. It really, truly was a team effort. Thanks senior leadership for supporting and endorsing virtually every program we've pitched, and part of that has been because we've had success. Mm-hmm. You have 5 successes. I want to do a 6th program. Well, your first 5 worked out pretty well. Let's do it again. So thanking leadership for supporting and endorsing and believing in this whole new concept that we put together back 7 years ago at this point. And then the human resources contacts around the health system, the safety officers, they report up into the leadership of the hospitals, but partnering with them and facilities people too. So, we have a reporting structure where, somebody had a slip and fall in a parking lot that would come to us. We'd reach out to the facilities people and say, look, there's something going on the 2nd floor of the garage at Manhasset, kind of thing. And that helped mitigate future injuries that were happening. This kind of weather. We got hit pretty good this year because it was so bitterly cold and so much snow. So we got a lot of slips and falls. But just communicate, work with everybody, and I really again thank so many people for believing in what we were doing. I still have some people who are skeptical about it, and that's what I was talking about. Stay on target. Still have to talk to those people. And for example, this whole COVID situation, we got hammered pretty well. And we were reaching out to employees who had been exposed to COVID who never submitted an incident report, but we were reaching out to them because it was the right thing to do. And that's, I guess that's the underlying message is if you're doing the right thing and you're advocating for employees, everything else will follow.
Well, that's a great message. And it sounds like you have a wonderful team. And so I want to close out by saying, again, thank you, Joseph Molloy, for joining me today to talk about your win with the Comp Laude Awards. And since you are familiar with the process, we are currently in the nominations phase. So I really hope that perhaps some of your team members will be nominated, and that if we can share that information, it's basically just complaude.com. And the nominations form is there, and we would love to see some of your team members nominated, as I'm sure they, because they're part of your program and they understand how it works and are great team players, there may be several that should be recognized. So,
Oh, I didn't know we could do that, but we will absolutely take a look at that.
yeah. So, shout out to everybody that's watching. The Comp Laude Awards are open to anybody in the industry can make a nomination for any person or any organization.
Thank you. Appreciate it, Yvonne. Thank you for your time.
Thank you. And again, congratulations.